Now, we talked a little bit about spinal stenosis. Here is some of the novel treatment opportunities. Remember, amongst the treatment, we said medications such as gabapentin or other things for nerve agents. We also talked about physical therapy, improving the distance that you can walk. We talked about lifestyle choices and changes and smoking cessation, weight loss, and all of that category. Then things that we do, which include injections, putting some steroid to kind of shrink the nerves a little bit, make them a little more mobile. And finally, what are the other surgical options? Of course, one of the surgical options is a larger surgery where they actually do what's called a laminectomy and sometimes a fusion. This is called the lamina up here, and they can take the roof off of here and try to open up this space in here, or they can kind of cut down in here. If they have to do enough of it, they'll have to lift it up and maybe put some hardware, some screws from the back, and kind of hold that separation. Now that's a bigger surgery, and don't get me wrong, spinal stenosis surgery when performed in the appropriate candidate can be excellent. It can be transformative. Sometimes we don't need to go to that extent. So some of the really unique, innovative ideas that have come up is, well, if we look at our spine model, remember we said that spinal stenosis is squeezing from degeneration or arthritis. Here's the joint, narrowing of this. Now this is the lateral canal. This nerve is kind of really squeezed down, and the surgeries are involved in trying to open that space up. What if we could open that space up without major cutting and opening up the back? Well, how we have to think about it is a car jack. If we could kind of put a car jack in here, like how we jack up a car, and go crank, 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 crank. Wow, look at that. We're able to open up the space quite a bit. And in that regard, there's a couple of different products out in the market. I have one of them here with me. I'm not endorsing any one product over the other, but I'm just showing an example of that. So, quick look at the anatomy. The spinous process here, that's what you can feel in the back when you push down in the back. And this is the facet, or the joint, so you can see how it rubs together. The disc is here. The nerves exit the foraminal canal here. And we want to open up this canal, open up this area, open that canal up a little bit. So a good grabbing point is the spinous process. So if I can get something into the spinous process and do that, see how I lifted that up? And if I can keep it there, look at the opening here. Let me do it from the other side. It looks a little bit better. If I can put something in here, see how I've opened up this area? As opposed to not having it, it can be crunched down.